Hi, my name is Dr. Michael Veslak. I'm a chiropractor in Camarillo, California, and today what I'm going to talk about is peripheral neuropathy and how 20 million Americans suffer from this particular condition, and most unfortunately don't find much relief. So, to give you a little bit of background, I've been working with neuropathy patients for approximately 7-8 years now. I would say for the prior 22, 23 years of my practice, I really didn't have any solutions for these patients, but I always looked and strove to find something that was going to be beneficial to help these patients. I wrote a book, it's called Feet Don't Fail Me Now, that kind of outlines the non-surgical approach that we provide in this office. And I was fortunate enough to be the group leader of the neuropathy support group at the Camarillo Healthcare District for a couple of years. So some of the symptoms are burning, pain, numbness, tingling, cramping, sometimes restless legs. These are all common symptoms of peripheral neuropathy, and each person can be affected slightly different depending on which nerve fiber is involved. The medical treatment to date pretty much is prescribing medication. It's gabapentin, Neurontin, Lyrica, and what we have found is oftentimes these medications just don't work. So you go back to the doctor, they start to up the dose, and hopefully if you have neuropathy you were fortunate enough that this did help you, but what we have found is the patients that come to see us, this did not provide great relief for them. So our approach is a little bit different. It's extremely comprehensive. It's very effective, there are no drugs involved, and it's virtually painless. So what we have found is a common thread with all chronic conditions, and especially peripheral neuropathy. So besides the degeneration of the small nerve fibers and a shutting down of those large diameter afferents, what we have found is there is an underlying metabolic component. There is an inflammatory aspect to this, and it's not just high blood sugar like the diabetic neuropathy patients. The other part is we have found that every single patient is a little bit different. What's driving that inflammation? So being a certified functional medicine practitioner, I'm able to look at your labs, do an examination, and determine what is driving this inflammation. What is the root cause of the inflammation? Our treatment is designed to stimulate the large diameter afferent fibers and the small nerve fibers that have degenerated. We have 4 different types in our office depending on what type of neuropathy you have. I would say the latest machine that we just recently purchased was the Hako Med. We've seen incredible results with this. Recently we had a patient, been to 2 other practitioners. I think I was his 11th or 13th doctor that I have seen, and within 2 weeks he's able to now stand on his toes, go up and down the stairs, which he hasn't been able to do for years, walk distances without discomfort. That's after 2 weeks of therapy. We also offer different exercise to improve balance, coordination, strength, proprioception, and flexibility. Now this is probably the most important part, and I want to make sure you get this and that you really listen to this part. To treat the peripheral neuropathy, it's very important that you have to identify and treat the underlying cause, which is different for every patient. There's a reason why those nerve fibers degenerated, and that reason is a little bit different for every patient. So again, functional medicine gets the root cause, the problem, and then once we decrease that inflammation and then stimulate those nerve fibers, our success rate has been extremely high. So our patients, we require them to actively participate. If you just sit back and don't do anything, you're not going to get better. And you probably already have realized that. So diet and lifestyle changes are a must. We're going to make different exercises that are going to be specific to you, that will stimulate the particular nerve fiber that has been degenerated. And then it's very important that the patient decides that it's time to make a change in their life. The changes we're going to ask you to do are not hard. They're all pretty basic, and you'll see if you follow my instructions there will be overall improvement in your condition. So our offer today is we're going to do a consultation, a complete orthopedic neurological examination, evaluate your labs, functional medicine, and we're going to just charge $47 for this. Normally this type of examination in my office costs $395. So the offer though is limited to just 8 callers because I have a fairly busy office and we can only accept 2 new neuropathy patients per week. So this offer will be limited until April 22nd. So I'm gonna 1 month, the first 8 callers for $47. You can call 482-0723. Again, I'm only looking for people that are truly looking to improve the quality of their life and that have a pain level which they consider is above 5. Thank you so much.